Thank you for coming today. Today we're going to be sharing to you about Caya Health and whole person healthcare. So what is whole person health? At Caya Health, we treat people from a perspective that emphasizes body, mind, and spirit. So each of these factors are interconnected, and anything that affects one of these factors also affects the other two. Optimizing health involves addressing all three areas. From a primary care perspective, we can keep our bodies healthy through healthy diet, regular exercise, and healthy lifestyle habits.
The other aspect of this whole person care and this whole person concept is the mental health component. Our psychiatrists and counselors provide evaluation, diagnosis, and treatment of mental health disorders. That's not to say that you have to see one of our counselors or our therapist. If you just want to see Dr. Edwards, you can just see Dr. Edwards. There is opportunity and options for all three of these components for you when you come over to us.
So this is our medical team, and so as part of the primary care, we have myself, Dr. Edwards, and I also work with a nurse practitioner. Her name is Sarah Sloan, and she is wonderful as well. We do annual Medicare exams. We treat chronic conditions such as diabetes, heart disease, hypertension. We do women's health and minor skin procedures. We do have vaccines available, and we also do lab draws in the office. We treat dementia and as well as anxiety and depression.
The behavioral health portion of our clinic is provided by Dr. Dubé and our nurse practitioner, Milian. They provide the medication management as well as something called transmagnetic stimulation for severe depression. Our therapist, Michelle, who you folks have met, does the educational groups and workshops and something else called talk therapy. And I love this next slide because the picture really depicts what talk therapy is. Does anyone want to guess what talk therapy is or have an idea? My young ladies over there, Joanna, you're shaking your head yes, you know. What do you folks think that talk therapy is? Yes?
I think talk therapy is getting together with your friends and talking.
Yeah, that's a really good...
If I don't feel good one day, I'll tell somebody, and somebody will say, well, this is going to be better, and it is.
It always is, right? And talk therapy is a really effective way to manage and sometimes even prevent mental health conditions. Because sometimes in our head, you see on the left, the lady in the blue shirt, all of the thoughts that she has and all of the things that she's worried about just doesn't really make a whole lot of sense in there. And then when you get to say it out loud, in talk therapy, the therapist's role is to kind of categorize them, and then the therapist helps you and gives you tools on how to better manage them. Now, if you're in talk therapy with Michelle or one of our other therapists, and it's just not working or you're not progressing or you're not feeling better, then Dr. Dubé or Milian can be consulted if you don't feel like you're not making progress in therapy. But talk therapy is a really effective way to manage and prevent mental health conditions.
Okay, so what is this mind-body connection? We know that each of our emotions affect different areas of the brain. This is a functional MRI demonstrating the areas activated by negative, ambiguous versus positive emotions. And then in turn, your body responds to these emotions. So negative emotions cause the release of stress hormones like adrenaline, and they cause your body to be alert. Versus positive emotions, they cause the release of other chemicals like serotonin and dopamine and oxytocin, and these actually cause a body response that causes us to relax. So for example, think about some positive memories like your wedding day or the birth of a child. And how does that make you feel? Generally, that would make you feel maybe calm, relaxed, and it's a full body experience. Versus think about maybe a negative experience like the loss of a loved one or a negative health diagnosis, and immediately how do you feel? So you might feel tense, anxious, depressed. And we know that the brain can change. So when we repetitively activate a particular pathway, either negative or positive, it strengthens that pathway. So it makes us more likely to respond in the same way in the future.
And talking a little bit more about that is something called neurogenesis and neuroplasticity. Has anyone ever heard of those two interesting terms? No? I know someone's shaking their head over there like, no, I've never heard of these things. So years ago, we thought our brains stopped growing after a certain age. But neuroscience and things like this have showed us that our brains can still learn new things, and that's what neurogenesis and neuroplasticity is. So try and stay with me as I try to explain these two concepts. Imagine that your brain is a highway, okay? And we take this highway every single time. When we travel it every single time, it becomes a well-beaten path, right? Our car knows where to go, the grooves are there, everything is there. So it becomes part of our habit, right? And these habits are what shape how we think, feel, and do. So let's say for the last 40 years, 50 years, you've been taking a negative path, which is like that picture all the way on the left-hand side. Your brain has had this well-beaten path for the last 40 years. It doesn't know any different. When you come to talk therapy, we teach you the new pathway, the positive pathway on the right-hand side. So what we do in talk therapy is we teach you that different path. So the more that we strengthen these newer positive paths, the old ones become obsolete. And that's what talk therapy does in our office for that.
Okay, so February is Heart Month, and there is increasing evidence that mental health can positively or negatively affect our heart over time. And so that's pretty astounding. Factors that have been shown in studies to negatively affect our heart are depression, anxiety, loneliness, pessimism, and anger and bitterness. And how is that? So we kind of touched on it, but these negative emotions cause the release of stress hormones. They cause inflammation in the body. They cause increased blood actually clotting in the body. And they cause nervous responses that increase our heart rate and blood pressure over time. So if you imagine over time, that puts a lot of stress on your heart. Versus our factors that positively affect our heart health are optimism, purpose, happiness, and mindfulness. Now, some normal changes as we age. We all experience these changes. Our vision changes, changes in our hearing, some balance issues, decline in mobility, and some brain changes. And these are normal changes. So what is the significance of this? The significance is that they can cause a loss of independence, decrease your ability to do physical activity, can cause difficulty with communication, and can cause increased isolation. So I'd love for somebody to share maybe some of the things that you've noticed as you've aged. Yes?
Well, certainly hearing loss, which is a major problem
exactly.
in our community. And all of these changes, the vision changes and the balance changes, they cause anxiety among people our age.
Yes.
And they become very fearful of how to move forward.
Yes, exactly. Thank you for sharing.
Can you repeat some of the things you guys said?
Yes. So some of the things she mentioned that kind of having the balance issues can cause a lot of anxiety, and that hearing is a big issue kind of as we age, and that impairs our communication, causes loneliness. And there was one other thing I think.
She said that it gives her anxiety.
Yeah, absolutely.
It gives you anxiety when you feel like you can't hear the other person or the other person can't hear you, and that's very true.
Yes, exactly. Thank you. So these are the normal changes that we age as we age, but in addition to normal changes, many medical conditions, they're associated with advancing age. So in the next slide here, we're going to show a lot of different medical conditions. So things like arthritis, heart disease, dementia, Parkinson's, So all of those factors we just discussed can make it even more difficult. So these can further affect us and can limit our mobility, decrease our independence, necessitate dietary changes, which can be hard. They can cause fatigue, and they can cause a lot of emotional stress. So we can see how medical conditions can affect us. And what about medications? How can medications affect us? So we know that as we age, we may need lower doses of medications due to the change in our body composition and also the change in our kidney function. The risk of drug side effects increases significantly as we age. So some of the common side effects that we notice are overtreated blood pressure, which can cause a lot of dizziness and falls. Medications can cause fatigue. And sleep and anxiety medications in particular, they can cause drowsiness and falls. So a hip fracture is an example of a significant health event that not only affects our body, causing prolonged recovery and a lot of pain, but it actually impacts all areas of our life. So after hip fracture, most will have difficulty with ambulation. They'll need physical therapy, need assistive devices. Secondly, there's the increased need for help with daily activities. So things that may have once seemed simple, like bathing and toileting, can be very difficult and require assistance. Thirdly, we can be restricted in the things that we can and can't do. So like cooking and errands as well. And finally, worry about a subsequent fall can cause significant anxiety. So we can see how all of this dependence on others, frustration with not being able to do the things we once could, and increasing isolation can put us at high risk for anxiety and depression.
Another significant medical condition that happens at times is a stroke. How many of you have suffered a stroke? So while we already know some of the physical limitations of a stroke, there are also some common communication and mood dysregulation that happens during strokes. So there was a recent study that came out that said 30% of patients have something called post-stroke depression, which actually makes sense because when you have a stroke, and as you're recovering and going through rehabilitation, the brain is undergoing rapid chemical changes. So when they looked at this study, they said, okay, patients that have had strokes are actually at a higher risk of depression than these hip fractures that Dr. Edwards was talking about. And the last point of the study was that they found that if patients that were treated for post-stroke depression actually lived an extra 10 years longer, which is huge. When you stop and think about it, it's huge. An extra 10 years from post-stroke depression. But half of you didn't even raise your hand when you said you had a stroke, but some other common mental health conditions that occur as we age are dementia, addictions, mood disorders, PTSD, clinical anxiety, and clinical depression, and that's what our psychiatrist actually specializes in. But what we see a lot of times is something called subsyndromal depression and anxiety, which basically means a person is having symptoms of depression and anxiety, but don't necessarily meet the clinical criteria for that. And I'm going to show you what that looks like with this anger iceberg. And I love, you're laughing, you like that? So this picture is actually a really good representation of what subsyndromal depression and anxiety can look like. So when we see someone, they look angry, right? We just see the tip of the iceberg. We just see someone who's very angry or irritable. But underneath that iceberg is where the big bulk of everything is. And underneath there, we might feel stress or exhaustion or lonely or guilt or trauma or whatever it is. But what we see a lot of times is just this. And that is something that in talk therapy that we provide, and we can help you figure out what it is that's actually underneath the tip of that anger iceberg.
What is it called? What?
Subsyndromal depression and anxiety. So again, it means you have symptoms that are like anxiety and depression, but you don't have the clinical diagnosis of it. And that's where in talk therapy, we're able to kind of talk about that and get all of those thoughts that are rumbled in our head, and the therapist kind of gets them together and gets them organized for you and gives you skills for that. But you might not have this. You might not have anger or irritability or anything like that. There are some other mental health conditions that are unique with aging. There we go. A lot of times, diseases like Alzheimer's disease, Parkinson's, heart disease, arthritis, they're all being treated, but we can't get underneath that. You know, we can't figure out what it is because it's overlooked. Mental health is overlooked. Depression is actually one of the most successfully treated illnesses, so why would we not treat it? It's a lot easier to treat depression than it is arthritis. Arthritis goes on for a really long time. A loss or decline of mobility and independence, as Dr. Edwards said, is very common. How does it feel now that your children have a say-so in a lot of the things and the decisions and choices that you're making? You're laughing about it, but it's true. It's very true. So when you get that loss of independence, it's it's not something that someone my age has to deal with, but it's definitely something that your age does. Widowhood. Can you identify the difference between normal grief and complicated grief and depression? 1/3 of widow and widowers meet the clinical criteria for depression the first month after the death of their spouse, and then remain clinically depressed for 1 year if they don't get treatment. Suicide, and I know that that's not something that we like to talk about a lot of times, but the rate for suicide for white males 85 and older is 6 times higher than the average, which is a big one. Substance abuse, specifically alcohol abuse, is the 8th leading cause of death of the elderly. And then dementia in the year 2025, it's expected, which really 2025 is just 3 more years away from now, 22 million people are estimated to be developing dementia. It not only deteriorates intellectual abilities, but it also has emotional disturbances as well. You can go to the next slide. So how have older adults fared during the pandemic the last 2 years? I'm going to pick on my lovely lady table over here. Joanna, what did we do? Joanna, what did we do the first few months of 2020? What did we do? What did we all do the first few months of 2020? Quarantined, right? We isolated. What did we do when your friends, if Myrtle becomes COVID positive, what do we do?
We have to test ourselves.
Test.
Stay away from her.
And quarantine and isolate. Again, what do you do when you have COVID? You have to isolate. We've all been a lot alone by ourselves the last 2, almost 3 years. And do you know that the biggest predictor of depression is isolation? That's the biggest one. It's not a history of depression. It's not a lack of resources. It's none of these things. It's loneliness and being alone. So I just wanted to point that out for you. But Dr. Edwards, what she'll do when you come to the office, she will look for some things that may suggest, hey, why don't you come and talk to Michelle for a little bit?
So we often perceive that depression presents with this gloom, misery, melancholy, sadness, and anxiety presents as this persistent worry and fear, but actually anxiety and depression present much more commonly with the following symptoms. So change in eating habits or weight loss, difficulty with sleeping is a very common one, withdrawal from family and friends, decreased energy. Many people will say, I just feel tired all the time. Increasing irritability and memory issues. And as we mentioned, mind and body are connected. So even physical symptoms can be manifestations like diarrhea, abdominal pain, dizziness, headaches, muscle pain. These can all be underlying symptoms of anxiety and depression. So this is an example patient, not a real patient, but a patient that commonly we see in clinic. So she presents to the office complaining of a poor memory. She's noticed the changes for the past 6 months. and symptoms started after her husband passed away. She's very tearful and crying when she's talking about it in the office. And we complete a full evaluation, including labs. Ms. Jones performs well on her memory testing, and she's actually diagnosed with underlying depression. She goes to talk therapy, and then her memory issues actually improve. So a second common type patient that we see is Mrs. Lee. Mrs. Lee says she's been feeling tired all the time. On further questioning, she admits that she feels down, depressed many of the days, and she has some trouble falling asleep. She's had many changes in the past year. So she's had some decline in her husband's health. She's needed to move to be closer to her family, and she misses her friends back home. So, in addition to managing her medical conditions and take a look at her medications to look at an underlying cause, Mrs. Lee agrees to treatment for her depression. Several months later, she's feeling more optimistic. She's exercising, which helps to boost her mood, and she's developed a good support network of friends and family in the area. So these are some healthy ways of managing your emotions and improving your health. So exercise has been shown. Exercise releases endorphins and positive chemicals that makes us feel much better. Getting outside, getting some sun, scheduling some time for activities. And then it is important to keep a good sleep schedule because sleep is very important for our mental health.
Some other things that you can do, talking with a professional counselor like Michelle in our office, something. Social support, which is exactly what you folks are doing right now. Believe it or not, this is social support. You're sitting at a table with 3 other human beings and just getting to learn each other and talk to each other. So that social support is helpful. And then there's something called this friendship line, and I wish that Florida had something like this, but I called it, because it's ran by the state of California, but I called it and they said, yes, Florida folks can call. So there is this friendship line that you can call. If you're feeling isolated, if you're in your room and you have to stay there for 10 days and you're quarantined and you've got no one to talk to, pick up the phone and call the friendship line. It's just little things like that that are going to help you with your mental health and your benefit for that. And then we also have something coming up, which is actually on our next slide. It's called Walk with a Doc, and I'll have Dr. Edwards explain that a little more.
So this is something I'm really excited about. We are starting in March 1st doing Walk with a Doc. It's going to be a weekly walk on Tuesday mornings from 8 to 9 a.m. It is free. You're welcome to come. Anyone's welcome. At 8 o'clock, we will meet at Caya Health, have a brief talk, 2 to 5 minutes, and then go on a walk. And so the idea of that is just getting out, exercising, being with other people, and just to improve our overall health. So everyone is welcome. We have handouts available if you would like to grab one, and we'd love to come see you guys out there.
Thank you all for your time.
Thank you all.